All right, welcome back. Some good vibes bubbling up on the medical side of things. More than 50,000 medical students at 73 schools in 36 states signing on to the Trump administration's nutrition education pledge, committing to at least 40 hours of nutrition training in diet, prevention, and chronic disease. The idea, 10 years from now, you walking in to see your doc and she's ready to talk about what's on your plate and why it matters. Joining me now with more, Jennifer Galardi, Senior Policy Analyst for Restoring American Wellness in the Heritage Foundation's DeVos Center. Jennifer, thank you so much for joining us. Wonderful to see you again. Now, diving right in here, as someone with decades of experience in the fitness and nutrition industries, in your view, why is it so important for our future medical professionals to learn more about nutrition?
Hi, Tiffany. Good to be with you again. Thank you for having me. Nutrition and food is really the front lines of health. So many issues people are trying to resolve, infertility, cancer, and even mental disorders are rooted in metabolic health, which can be often restored and healed through proper diet and nutrition. And what's pertinent to this initiative is that we will now begin teaching medical students how to use different diets and foods to help heal different conditions, or simply how to use food as medicine before prescribing the pharmaceutical products. And this comes, I say, with a caveat, because the nutrition curriculum should not follow the old dietary guidelines that Americans have followed for decades. And I think some medical associations and institutions still prescribe, namely kind of low fat. And it doesn't matter kind of where your carbohydrates come from. I hope that the new guidelines and the Eat Real Food message is really prominent in this new curriculum, and will inform the program that medical schools teach moving forward.
And as the Department of Health and Human Services reports, more than half of the states in our country now have schools committing to this nutrition education pledge. What does this level of commitment across the nation tell us?
I think it's great. I think it tells us that the MAHA movement's working, regardless of policy. The message is getting across. I think people have become very skeptical of mainstream bureaucratic institutions as well as medical institutions, and they're heeding the call of the American public. They want good information. They want real science around what's good for them. And it's even debatable if 40 hours will be enough, but it's heads and shoulders above where they were. I think they had medical students normally had about 4 hours of nutrition training. So it's a very good start. And I think it's a positive move forward for Americans and for doctors.
And Jennifer, to your earlier point, there's clearly momentum behind better nutrition, but what challenges would you say still remain for our society as a whole to adopt a healthier lifestyle? For example, is our reliance on heavily processed foods one of them?
Yeah, it's really hard to shift from kind of the supply of food we now have, the big kind of blow up of processed foods. So I always say, and I actually had this discussion with a colleague today, I'm a demand side person more than a supply side. And so I want to see American citizens kind of demanding better food, and then the food industry will have to respond. We're already seeing that. I was in the store a month ago and I saw like all natural Doritos. Now it's debatable if when people buy Doritos, they're thinking all natural, but I don't know if that orange stuff will get all over your fingers anymore. But I do think in general, people will are looking for more healthy alternatives. And that doesn't mean an end to processed food altogether. Yogurts that just don't have artificial food dyes, that are really yogurt, higher protein foods. I think you're going to see an increase in dairy products. So these are the types of kind of new nutritional guidelines that we see that were put out this past year. And I think that demand drives the need not only for additional nutrition coursework, but a new type of doctor altogether, like naturopaths, homeopaths, and functional medicine practitioners whose practice that use food as the first line of defense in treating chronic disease. I think that's what we're going to see across the board.
And very quickly, if this effort succeeds, what could healthcare look like, say, 10 years from now? How might better nutrition educate improve the, say, lives of everyday Americans?
I think it will drive the cost down measurably. I heard Kennedy say recently, I think it was today, I'm not sure what, can't remember. I see so many clips of him, which is wonderful that they're out there giving this messaging, but that obesity rates are down 2.5% since President Trump's been in office. And I really do attribute that to good messaging. And again, consumer demand for healthier products. I think we can see chronic disease care go down. I hope we see insurance rates go down. And ultimately, I'd love to see more medical freedom in that, Americans have flexibility of where to spend their medical dollars. So more HSAs that allow Americans to spend money more on the preventative side and alternative care than the traditional medical model.
Well, Jennifer Galardi, as always, thank you so much for joining us.
Nice to be with you.